Okay, today our topic is on hyperthyroidism. Our presentation will include the definition, planning, features, and advi. To start, we just have a video.
In hyperthyroidism, hyper refers to having too much, and thyroid refers to thyroid hormone. So hyperthyroidism refers to a condition where there's excess thyroid hormones. The condition is also called thyrotoxicosis and is generally due to an overproduction from the thyroid gland. Normally, the hypothalamus, which is located at the base of the brain, detects low blood levels of thyroid hormones and releases thyrotropin-releasing hormone into the hypophyseal portal system, which is a network of capillaries linking the hypothalamus to the anterior pituitary. The anterior pituitary then releases thyroid-stimulating hormone, also called thyrotropin, or simply TSH. TSH stimulates the thyroid gland, which is a gland located in the neck that looks like two thumbs hooked together in the shape of a V.
So as the video stated, hyperthyroidism is a result of too much thyroid hormones that is created in the thyroid, also known as thyrotoxicosis. This also raises thyroid hormones in the blood to excessive levels and affects various tissues of the body and creating an abnormally increased rate of metabolism. The cause of hyperthyroidism is known as Graves' disease. This is an autoimmune disorder. This tends to happen in younger women more often and can run in families. It is located in the thyroid. This is in the lower front of the neck when it's inflamed. This gland is butterfly shaped, and this gland uses energy, warmth, and keeps major organs working, like the heart, brain, muscles, and etc. And in children, this is necessary for normal growth. Some oral manifestations that can happen with hyperthyroidism is mild tremors of the tongue, increased possibility of caries, periodontal disease, extragranular thyroid tissue enlargement, osteoporosis of the alveolar bone, burning mouth, and some long-term effects, hyposalivation, xerostomia, mouth pain, and caries. Some other manifestations that can happen is the teeth and the jaw development could be earlier in children. Permanent premature loss of baby teeth and accelerated eruption of permanent teeth are also common. Loss of sensation of taste could also be a side effect from the antithyroid drugs that could be taken. Next, we'll be speaking about the features.
Being able to notice the signs of hyperthyroidism is crucial to providing the best care for clients. Clinically, radiographically, and microscopically are some ways we can look for symptoms and signs to further educate our client and ensure they get proper care they need. Clinically, the main symptom would stem around the neck and head and neck area, such as the goiter, which is when there is not enough or too much thyroid hormones being produced, and is an enlarged thyroid that comes nodular. When doing the head and neck assessment, checking for lumps in the neck as the patient swallows is another big indication that something may be wrong. Men will typically tend to develop more fatty issues in the pectoral region, and women will have irregular or absent menstrual cycles. Fatigue, intolerance to hot weather, weight loss, and muscle weakness are some more general symptoms that may show. Radiographically, an ultrasound or a chest x-ray can be done. Sonographically, the thyroid will appear normal in size, but can develop abnormal Doppler patterns, which is irregular blood flows. And radiographically, you'll see a nodular shadow on the x-ray. Microscopically, a blood test can be done to show the thyroid hormone levels. A client that presents with hyperthyroidism will have higher levels than normal. The thyroid is made of two hormones, thyroxine and triiodothyronine. These two play a crucial role in every cell, and with them being at a higher or lower level, it'll disturb the homeostasis that our cells try to achieve. And then to the right, there's a chart that shows the normal range of your thyroid levels.
So, diagnosing a client with hyperthyroidism. When doctors suspect that a client has hyperthyroidism, they will investigate the client's medical history and perform a physical exam of the thyroid for any signs of enlargement or tenderness. Also, they may take an ultrasound or a scan of the thyroid to see if the thyroid is making too much hormone. When diagnosing hyperthyroidism, doctors not only look at the signs and symptoms to make the diagnosis, but they use blood tests as well. Doctors may use blood tests that measure the TSH levels in the blood. TSH stands for thyroid stimulating hormone. Also, they may use a blood test that measures T4 and T3 hormone levels. These tests can help confirm a client's diagnosis. For the prognosis of hyperthyroidism, hyperthyroidism has many available treatment options and is a condition that is very treatable. There can be many complications without proper treatment and with underlying health conditions. However, many people respond well to treatment and can keep their thyroid hormones in a healthy range with medications and proper treatment. And then here's just a video that shows how to do a self-exam on yourself to check for thyroid changes.
Roughly half of adults over the age 40 have thyroid nodules. The thyroid gland is a butterfly-shaped gland in the neck. It sits between the collarbone and the Adam's apple. There are simple steps to take on your own to do a thyroid self-examination. To get started, what you'll need is a mirror and a glass of water. First, look in the mirror and tip your head back. Second, drink some water, swallow, and watch your thyroid move up and down. Men, you want to look between the collarbone and the Adam's apple. You want to look for any lumps or bumps when you swallow. Women, the Adam's apple isn't as visible. You want to look from the collarbone up. You will want to repeat this test several times. If you see any lumps or bumps or protrusions on the thyroid neck self-examination, that is something that needs to be checked out. It is very important you see your doctor for evaluation, and a thyroid ultrasound may be necessary. Roughly half of adults over the age 40 have thyroid nodules. The thyroid gland is a butterfly.
Here are some treatment options for clients with hyperthyroidism. Treatment for hyperthyroidism includes taking medications to get the hormone levels back to a healthy range. Beta blockers are used to help control symptoms of hyperthyroidism, including a fast heart rate, shaking, and anxiety. Another drug used is an anti-thyroid drug, such as metamazole and propyllathurazole. These drugs will help with decreasing the ability of the thyroid to make new hormones. Also, radioactive iodine treatment, which destroys the thyroid tissue, causing the cells to permanently cease producing thyroid hormones, is an effective and beneficial treatment which may eventually be needed for patients who do not have the thyroid surgery. Lastly, another treatment option would be surgery by removing the overactive thyroid gland. Depending on the circumstance, they may either remove the entire gland or only part of it. Before having the surgical removal of the thyroid gland, the hyperthyroidism would need to be monitored and under control with medications. So medical clearance and postponing treatment. So on the CDHO website under hyperthyroidism, it states that a medical clearance is required if severe hyperthyroidism is suspected and undiagnosed. Also, if the client is taking anti-thyroidal drugs, they will need a medical clearance. These medications can cause an increase of risk of serious infection. And then for postponing treatment, so antibiotic prophylaxis are not required, and postponing treatment may be required if the client has recently been treated with radioactive iodine. Hyperthyroidism is suspected. The client's hyperthyroidism is under controlled or uncontrolled and poorly controlled signs of cardiovascular issues, and if the client has any symptoms of untreated hyperthyroidism.
Okay, and then lastly, we're going to be talking about ADPI. So for the assessment phase, it's the data collecting phase. So we looked at subjective and objective data. So clients may report, or we might find sweaty skin, irregular or fast heartbeat, a goiter, which is the enlarged gland, scars on the neck from previous surgeries, lumps and bumps on the neck when the patient swallows. Like we mentioned, it's associated with Graves' disease, so we have to be aware of their medical history. Graves' disease is common with the bulging eyes. And as Paige mentioned, we advise medical consult when we suspect if it's undiagnosed, if we think the condition is over or under treated, or if the client has been treated with their radioactive iodine treatment in the past week. And then diagnosis. This is how can our assessment findings be associated with the client's condition? So there are certain medications that they take that can induce xerostomia. So this puts the patients at risk for periodontal disease as well as caries. It's important to kind of look at these factors when we create their plan, which is in the next step. Okay, so then when we look at planning, it's client specific measured plans, and then we select them and create a plan. So clients with hyperthyroidism are more prone to stress and anxiety. It's important to recognize this when planning, so we can do brief appointments to kind of reduce the stress. And then there's certain emergency situations, like thyroid toxic crisis. Some signs and symptoms of that is tachycardia, irregular heartbeat, and GI and central nervous system symptoms, and a fever. They can also be prone to acute anxiety attacks, which resemble panic attacks, and also reaction to epinephrine, which would interfere with the cardiovascular system and lead to hypertension. It's important to kind of be aware of these possible scenarios and know what to do while you're planning for this client. Ideally, a client with this condition has more frequent recalls because of their higher risk of periodontal disease and caries. So we have to have kind of realistic goals in mind that are client specific. If they're experiencing dry mouth, like we can recommend xylitol products or whatever we think might help them. And then implementation, this is just carrying out the plan. So ideally, like I said, ideally these clients would see us more frequently. Every client is different. However, considering this condition poses a common symptom of xerostomia, it is important to acknowledge the risk for oral implications and continue to recommend products and treatment specific for them. And then also just when they see us, encourage them to let us know of any new signs or symptoms. And then lastly, evaluation. This is just assessing if the treatment plan was successful and if the client met their goals. So we ask ourselves like, did my client report less symptoms of dry mouth? Were my product recommendations helpful? And this is when we would consider any possible modifications to the plan if need be.
Thank you for listening. These are resources.